Hello and welcome to True Pathfinder, your portal to health and truth. And in this video, we're going to look at a health condition that affects millions of people around the world, the so-called Sjoegren's or SICCA syndrome. What is it? What are its causes, the symptoms, and how can you treat it naturally and effectively? Well, let's find out. But before we do that, short reminder, if you enjoy our content, please support us directly by becoming a Patreon from as little as $5 per month. Link in the description box below. Also, do not forget to like, share, subscribe if you're not already, and comment to help this channel grow and spread the truth. For the holistic care you need and deserve, do not hesitate to contact us at christine.doctor and check out some of the most powerful holistic health tools available on the market today at vibrantbody.net. Links as always in the description box below. Alright, so what is this Sjoegren syndrome or SICCA syndrome? Western medicine defines it as a chronic autoimmune rheumatic disease that is characterized by lymphocytic infiltration of exocrine glands and other organs associated with the production of various autoantibodies in your blood. The disease develops invisibly for months or even years in most cases, and the most common clinical manifestations are a dry mouth, dry eyes, and a swelling of the major salivary glands. Moreover, some patients manifest signs and symptoms of the liver, lung, and other organ damages. Multiple studies that have been published in recent years show that Sjoegren syndrome, like other immune diseases, can severely affect a patient's quality of life, especially when SS is not diagnosed correctly. SS patients have a very high rate of severe depression and anxiety, as has been found out. And for example, in 2008, an epidemiological study estimated a prevalence of Sjoegren syndrome ranging between 0.4 and 3.1 million individuals in the USA alone. So it's a pretty common condition, as you can see. A 2015 study showed that the overall prevalence of FS is 0.03 to 0.3% globally. And the serious injuries and rising incidence of SS have placed a significant burden on patients, their families, society as a whole, and the world. Medicine decided that there is no therapy really for SS patients, and to better understand and diagnose SS, we must look at the salivary glands and the ducts, which are part of the so-called alimentary canal. So let's do that. Your salivary glands are in the so-called alimentary canal, and the organs of the alimentary canal from the mouth to the rectum derive from the oldest embryonic germ layer, the so-called endoderm, and are therefore controlled by the brainstem, which is the oldest part of your brain. In the brainstem, the control centers of the organs of the digestive system and its descendants are positioned in a ring-form order, starting on the right brain hemisphere with the brain relays of the mouth and pharynx, including your thyroid gland and the parathyroid glands, the esophagus, the stomach, the liver parenchyma, the pancreas gland, the duodenum, the small intestine, and then it continues counterclockwise with the control centers of the appendix, the cecum, the colon, the rectum, and the bladder on the left side of the brainstem, as you can see also in the picture here on the right. And according to their function, the biological conflicts linked to the organs of the alimentary canal are morsel conflicts of not being able to catch a morsel or to eliminate a morsel. So not being fast enough to catch or eliminate a morsel, and that affects your thyroid gland, or not being able to swallow a morsel, and that affects your esophagus. Also not being able to absorb and digest a morsel, and that affects your pancreas, stomach, small duodenum, the intestine, and the colon. For animals, a morsel concerns a real piece of food, whereas for us humans, a morsel can also be figurative. The mouth is the opening of this alimentary canal and a place where the digestion and absorption of food starts. So it has a secretory and an absorptive quality. The tongue is an accessory digestive organ that aids, of course, in chewing and swallowing. And through chewing, the food is broken down into small pieces for digestion. The saliva produced in the salivary glands moistens the food to make swallowing easier, and the salivary glands are in several parts of the mouth. The most prominent salivary glands are the so-called parotid glands in front of your ears, then the sublingual glands underneath the tongue, and the submandibular glands beneath the lower jaw. The pharynx connects the mouth and the nasal cavities with the trachea and the larynx. And the nasopharynx, which is located in the back of the nose, extends to the upper surface of the palate, which forms the roof of the mouth. The oropharynx is at the very back of the mouth. On both sides of the pharynx lie the tonsils. And branching off the pharynx is the esophagus that carries food from the mouth to the stomach. The submucosa of the mouth and pharynx, including the lips, the gums, the palate, the tongue, the salivary glands, tonsils, and the throat, consist of intestinal cylinder epithelium, which originates from the endoderm and is therefore controlled from the brainstem. In the brainstem, the organs of the mouth and pharynx have two control centers that are orderly positioned within the ring that form the brain relays, which control the organs of the alimentary canal. The right half of the mouth and pharynx are controlled from the right side of the brainstem, and the left is controlled from the left hemisphere, and therefore there is no crossover correlation from the brain to the organ. The mouth and pharynx, the tear glands, the eustachian tubes, the thyroid gland, the parathyroid glands, the pituitary glands, the pineal gland, and the choroid plexus share the same brain relays, as you can also see from the pictures here on the right. Let's discuss in a little bit more detail the different biological conflicts and the problems they create. The right half of the mouth and the pharynx correlate to an ingoing food morsel conflict, or the feeling of not being able to catch a morsel, or not being able to swallow a morsel. Not being able to swallow a morsel affects your tonsils, pharynx, and throat. Not being able to catch it affects the mouth, lips, gums, palate, tongue, and salivary glands. Newborns and infants experience the conflict in real terms when they cannot get the milk morsel because the mother is unable to nurse or is not feeding her baby in time. Seniors in nursing homes and hospital patients suffer the conflict when they cannot eat because of pain, for example. Also, cancer patients cannot eat due to their chemo treatments, and this also creates this type of conflict. On top of that, refraining from eating your favorite food because you have been put on a strict diet, as an example, can also cause a morsel conflict. A figurative morsel, one is not able, in a figurative morsel conflict, one is not being able to catch. And that refers to something that you have expected or you was looking forward to grab or swallow, and which you are unexpectedly not able or not allowed to have. Such a desired morsel could be also a deal, a contract that you really wanted, a business that you really longed for, or a job, a position, a promotion, or money morsel in the form also of a loan, a profit, a gift, or an inheritance. For children, it could be a toy morsel or a good grade morsel. The conflict might also concern a person that you cannot catch or get a hold of, or a relationship you are not able or not allowed to consume, so to say. The right half of the nasopharynx relates to a scent morsel that you cannot catch, for example, the scent of a loved one who has left you. Initially, before the rupture of the gullet, the biological conflict related to the outgoing section of the intestine was not being able to sufficiently salivate the fecal morsel because mucus produced in the gullet also served as the lubrication of feces to facilitate its elimination. Today, the conflict linked to the left half of the mouth and the pharynx correlates to a so-called outgoing food morsel and not being able to eliminate a morsel, so to spit it out. This refers, for example, to food or medication you literally want to puke out. An undesirable morsel might be associated with a commitment, also a promise to revoke, or an agreement that you want to call off. A newly hired employee, a new tenant or roommate, a new sibling, or an annoying visitor could also be perceived as a morsel that you want to get rid of. In sports, it could relate to not being able to pass the ball, for example in soccer, or the puck in hockey. An outgoing morsel can also be a word or words that you are not allowed or you are unable to spit out. For instance, an apology, a confession, a plea, or a complaint. Unwanted or forced oral sex might also evoke this type of conflict, and the left half of the nasopharynx relates to a scent morsel that you cannot get rid of, for example, the scent of an opponent or a competitor. And as with all biological conflicts, we have two phases, the so-called conflict active phase and the healing phase. Let's see what happens in each one of them. During the conflict active phase, the cells in the mouth and the submucosa proliferate proportionally to the intensity of the conflict. The biological purpose of the other cells is to better salivate a morsel, to absorb it for the right half or to expel it for the left half, or to absorb or expel it faster. Additionally, the autonomic nervous system stimulates salivation, and therefore the secretion of saliva increases with the smell of mouth-watering food. In the English language, salivating and drooling are synonymous for craving for something or someone desirable. With prolonged conflict activity, a flat growth, an absorptive type, develops in the submucosa of the mouth. In addition, the palate, the salivary glands, the tonsils, the pharynx, and the throat can also take a cauliflower-shaped form, a so-called secretory type. If the tongue's papillae containing the taste buds are affected, the other cells provide an enhanced sense of taste to analyze the morsel. Significant growth is usually diagnosed as an oral or mouth cancer or as a glandular tumor if it involves the salivary glands. Smoking and alcohol abuse are said to be risk factors for cancers in the mouth, including tongue cancer. Yet, not everybody who smokes, as you know, or drinks develops oral cancer. If, however, the cigarette morsel or the alcohol morsel causes distress, for example due to abstinence, withdrawal, or fear of getting a mouth or tongue cancer, the biological special program will be set into motion. On a CT scan, the conflict-active phase of a morsel conflict presents as a sharp ring configuration, as you can see here also in the picture at the bottom right. And here the right brainstem hemisphere in the brain relies on the submucosa of the right side of the mouth. At this point, the conflict of not being able to catch a morsel is still active. Adenoids in the nasopharynx form as a result of a hanging conflict when the scent morsel conflict cannot be resolved in time. If the tonsils are affected, this causes so-called tonsillar hypertrophy or enlarged tonsils. And since the tonsils and the nasopharynx share the same biological conflict, nasal polyps and enlarged tonsils often occur together. After you've resolved the conflict, fungi or mycobacteria remove the cells that are no longer needed. In the mouth, the healing phase presents as canker sores, also known as aphthous ulcers, on the inside of the lips or cheeks, on the palate or tongue, or in all areas of the mouth, depending on the perception of the conflict situation. Canker sores appear as round or oval white spots with an inflamed border, and they can be pretty painful. On the gums, the pus-filled pocket is called a dental abscess or gum abscess, and the tuberculous discharge causes terrible breath. If the required microbes are not available upon the resolution of the conflict, the additional cells remain, and eventually the growth becomes encapsulated with the connective tissue. In conventional medicine, this is usually diagnosed as a mouth polyp or cancer. For example, a gum polyp might reach into the neck of a tooth. Oral candidiasis or thrush, presenting as a creamy pus, occurs when the fungi assist the healing process. For example, babies typically develop thrush when they are distressed because they cannot get a milk morsel. Tonsillitis, which is an inflammation of the tonsils, is a sign that a related morsel conflict has been resolved. And when pus produced during the healing process, so-called purulent tonsillitis, is released into the mouth, this also causes a very smelly breath. Here we also find tonsil abscesses. Tonsillar mycosis or candidiasis of the tonsils indicates the presence of fungi, compared with the strep throat, which indicates the involvement of Streptococcus bacteria. In the nasopharynx, the adenoids or nasal polyps that have developed during the conflict-active phase are removed with the help of fungi or TB bacteria, provided they are, of course, available. And the nasal discharge consists of smelly tubercular secretion. A nasal abscess with painful swelling containing pus also develops in the healing phase. Zenker's diverticulum is a pouch at the lower level of the pharynx, just above the upper esophageal sphincter, and that develops from hanging healing. And because of the continuous bacterial cell removal process, the wall of the pharynx becomes thin, and the weakest portion of the pharyngeal wall balloons out, forming a diverticulum. The most common symptom of Zenker's diverticulum is difficulties swallowing food. In the salivary glands, a prolonged healing process, or hanging healing, leads to a complete loss of the saliva-producing acinar cells, which results in a permanently dry mouth, or what is called Sjoegrensyndrome or SICCA syndrome. Additionally, inflammation in the salivary glands, for example in the parotid glands, causes parotitis, which is also known as mumps. The mucosa of the mouth and the pharynx is covered with a cell layer composed of squamous epithelium, which derives from the ectoderm and is therefore controlled by the cerebral cortex. The epithelial lining of the mouth and pharynx, including the surface mucosa of the throat, is controlled by the premotor sensory cortex. The right half of the mouth and pharynx are controlled from the left side of the cortex, and the left half is controlled from the right cortical hemisphere. Hence, there is a cross-correlation from the brain to the organ. The brain relays of the tongue and throat are located laterally. The biological conflict linked to the mouth surface mucosa, including the lips, gums, palate, and tongue, is a so-called oral conflict of either not being able to take something into the mouth or the opposite, not being able to get rid of something that is in the mouth or on the tongue. In both cases, this concerns food that you desire but you are unable or not allowed to take in. For example, when you're on a restricted diet, as is the case for diabetics, or you just want to spit out the food because you don't want it. Regarding the latter, this differs distinctively from the conflict of not being able to eliminate a morsel that is linked to the left half of the mouth submucosa. While the deep endodermal layer of the mouth correlates biologically to the actual morsel, be it real or figurative, that you want to expel, the upper ectodermal layer is rather about contact with the morsel, namely wanting to separate from what is in the mouth. Conversely, the conflict of not being able to get something desirable into the mouth can be triggered by having to refrain from, for example, cigarette smoking or alcohol. A lip-related conflict translates into the loss of physical contact or the fear of losing touch associated with the lips, for example, if one is no longer able or allowed to kiss a person or a pet. It also applies to not wanting to be kissed or having tongue or lip contact. And this also includes communication with objects such as a drinking glass, a straw, eating utensils, dental tools, and the like. In a figurative sense, the oral conflict translates into not being allowed or able to say something that is literally on the tip of your tongue. In line with evolutionary reasoning, territorial conflicts, sexual conflicts, and separation conflicts are the primary conflict themes associated with organs of ectodermal origin, which are controlled by the sensory premotor or postsensory cortex. Your saliva is produced, of course, in the so-called salivary glands, so the sublingual, the submandibular, and the parotid glands, and it reaches the oral cavity through the so-called salivary ducts. The moisturizing function of saliva allows to insalivate the food morsel so that it can pass easily from your mouth into the esophagus. The lining of the salivary gland ducts consists of squamous epithelium, which originates from the ectoderm and is therefore controlled by the cerebral cortex. And the epithelial lining of the salivary glands ducts is controlled by the premotor sensory cortex, which is part of the cerebral cortex. The right salivary gland ducts are controlled from the left side of the cortex, and the left salivary gland ducts are controlled from the right cortical hemisphere. And hence, there is a crossover correlation from the brain to the organ. Based on the role of saliva in the salivation of food, a biological conflict linked to the salivary gland ducts is not being able to eat or not being allowed to eat. Children experience the conflict, for example, when they cannot get desired food morsels, for example, chocolate or ice cream or candy. And for adults, particularly for women, when they don't allow themselves to eat, for example, to lose weight. People on strict diets, including diabetics, are also more susceptible to such type of conflicts. The biological conflict of the salivary gland ducts follows the so-called gullet mucosa sensitivity pattern with hypersensitivity during the conflict active phase and hyposensitivity in the healing phase. During the conflict active phase, ulceration in the salivary gland ducts is proportional to the degree and the duration of conflict activity, and the biological purpose of the cell loss is to widen the ducts so that more saliva can be delivered to the mouth to facilitate the salivation of food. And the symptoms are pain that can range from mild to severe. During the first part of the healing phase, the tissue loss is replenished through cell proliferation with swelling due to the edema, so fluid accumulation in the healing area, and with concurrent water retention, so a kidney syndrome, the increased swelling might obstruct the salivary gland ducts, causing parotitis or mumps. Mumps develops in the healing phase of not being able or not being allowed or being unwilling to eat, with swelling in the parotid gland ducts or from not being able to catch a morsel for the right side or not being able to eliminate a morsel for the left side, involving the parotid gland. Mumps, by the way, is not only a children's disease, but also can affect adolescents and adults. The theory that men who contract mumps after puberty risk developing orchitis, which is an inflammation of the testicles, has no scientific basis. Besides, the existence of a so-called mumps virus has never been substantiated, as is the case with all other types of viruses. Whether the right or the left salivary gland ducts are affected is determined by a person's handedness and on whether the conflict is a mother-child or a partner-related one. Prolonged healing because of continuous conflict relapses results in a permanent blockage of the saliva flow, which causes a dry mouth. And this condition, as we've seen, is called Sjoegren's or SICCA syndrome. It also can lead to dry eyes, by the way. Conventional medicine argues that Sjoegren's is linked to low estrogen since it predominantly affects women after menopause. However, not every postmenopausal woman has Sjoegren's syndrome. From our perspective, the increasing rate of the dry mouth syndrome is not at all related to a woman's hormone levels, but to today's diet mania and more women experiencing the distress of not being allowed to eat what they crave. The theory that Sjoegren's is an autoimmune disease, suggesting that the body's immune system mistakenly somehow attacks its own body cells, makes the 5 biological laws pointless, really. A salivary duct stone, by the way, is a calcified structure that forms inside the salivary duct, so in the sublingual or submandibular gland, as a result of a hanging healing. And a large stone can even block the flow of saliva into the mouth. Okay, now that we've discussed in detail the biological conflicts that can cause a dry mouth and dry eyes, and other problems as we have seen, let's look at some powerful natural remedies that can help you, starting off with REHMANNIA. We all live in a permanent state of stress nowadays due to our lifestyle, where we rush from one place to another, everything is moving so fast, and this, according to TCM, can burn the yin and deplete the kidney qi, and thereby leave you susceptible to more profound immune-based diseases. The knowledge and understanding about REHMANNIA comes from traditional Chinese medicine and the materia medica, which includes 2 types of preparations: raw REHMANNIA, also known as Sheng Di Huang, and prepared REHMANNIA, called Shu Di Huang. Both natural and formulated REHMANNIA nourish the yin and the blood. However, the raw Sheng Di Huang is used more to dissipate heat allowing the body thereby to generate more fluids, while the prepared Shu Di Huang is used more to nourish the body when deficiencies of yin qualities of cool and moist result in too much heat or dryness in the system. Raw REHMANNIA, so Sheng Di Huang, is energetically cold, sweet and bitter. It works in the heart, the kidney and the liver channels. Raw REHMANNIA nourishes the yin and the blood and generates fluids, countering the dry expression of yin deficiency. Dry symptoms that indicate a yin deficiency are seen in the menopause often with dry hair, skin, a dry vagina, as well as in autoimmune conditions like Sjoegrensyndrome that we're discussing here that manifests with a dry mouth, dry eyes, and the SICCA complex. With its bitter energy, raw REHMANNIA is antipyretic, clearing the heat and cooling the blood. It is helpful in high fevers also, and in cases of bleeding or hemorrhaging when too much heat in the blood drives excessive blood loss. Symptoms of insomnia, irritability, low-grade fevers, mouth and tongue sores, and malar rashes can also indicate excess heart failure and can be treated with REHMANNIA. Prepared REHMANNIA, so the Shu Di Huang, has been cooked in wine, rendering its energy sweet and warming. It also works in the heart, kidney and liver channels and is said to tonify the blood and nourish the yin. This is needed when there is deficient blood with symptoms of dizziness, lightheadedness, palpitations and insomnia. Additionally, prepared REHMANNIA is a tonic during pregnancy and after excess menstrual or postpartum bleeding. Clinically, kidney yin deficiency presents itself as adrenal fatigue and adrenal exhaustion. It is especially prevalent in perimenopausal and menopausal women who have worn out their adrenal glands throughout their lives and, as they move into menopause, don't have the support of estrogen production from the adrenals. Fatigue can be the presenting symptom, but below are yin deficiency symptoms such as insomnia, night sweats, premature graying of the hair, an aching lower back, joint pain, a loss of libido, and skin, hair, as well as vaginal dryness. For men, erectile dysfunction and nocturnal emissions can go hand in hand with the adrenal issues. And in these cases, REHMANNIA glutinosa along with adrenal support will be the most effective treatment. We like to combine REHMANNIA with licorice and add other herbs to this base to get the best results. By the way, as mentioned, contact us please at christine.doctor and we will develop a custom-made therapy plan just for you and your particular problem. Link in the description box below. The Chinese physician Zhang Xingye observed that during his lifetime, most diseases involved a yin deficiency, and therefore he specialized in REHMANNIA-based formulas. He stated in his writings that REHMANNIA is needed to guard the yin in cases of deficiency that involve the scattering of the spirit, and the heaviness of REHMANNIA is needed to counter the rising fire of yin deficiency. The calm and quality of REHMANNIA is needed for pacifying the agitation of yin deficiency, and the mild sweetness of REHMANNIA is needed for relaxing the impulsive nature of the yin deficiency. REHMANNIA is also needed to restrict the flooding of water, even in cases of yin deficiency, and is also needed to retrieve the scattered genuine qi back to its origin in the kidney. In TCM tradition, herbs have always been administered in formulas to balance any extremes of an individual herb. For example, the REHMANNIA that we have discussed has a heavy, dense energy, especially the prepared REHMANNIA. So it is often given in recipes with herbs to lighten and disperse the heaviness. One such formula is the so-called REHMANNIA 6 formula, also known as Liu Wei Di Huang Wan, and is made up of 3 herbs that warm and nourish 3 different organs, as well as having a cooling and dispersing herb to pair with each for balance. So it has REHMANNIA glutinosa and Alisma plantago aquatica. They are there to restore the kidney yin and normalize kidney function. Then it has Cornus officinalis fruit and Paonia subfruticosa that improves liver function and provides moistening actions to the kidneys. It also has Dioscorea opposite and Poria cocos to improve spleen function and thereby increasing the nutrients and the nourishment of the blood, which in turn improves liver health. REHMANNIA 6 formula improves digestion and regulates the sugar metabolism and is often given in malabsorption, failure to thrive, and diabetes mellitus. It is very beneficial for immune function, which is closely linked to the health of the digestive tract. And being a kidney tonifying herb, it also addresses urogenital disorders, including chronic glomerulonephritis and urinary tract infections. It also enhances cardiac function and reduces hypertension and helps with vision problems, especially diminishment of close-up vision and other symptoms of aging that are linked to a kidney yin deficiency. Those all can be very well treated with this REHMANNIA 6 formula. Next, we have the so-called 4 decoction to tonify the blood. Si Wu Tang is a more specific preparation for the tonification of the blood, and it is made up of 2 herbs that build blood and 2 herbs that move blood. And it works to correct blood deficiency and blood stasis. As we've discussed, raw REHMANNIA glutinosa tonifies the liver and kidney, nourishing the yin of the blood. Then it has Paonia lactiflora, which tonifies the blood and preserves the yin, as well as Angelica sinensis, that invigorates the blood, nourishes the yang of the blood, also regulates the relationship between the liver and the kidneys. And it also has Ligusticum wallichi, which invigorates the blood and promotes the movement of qi. Kerry Bone writes about REHMANNIA glutinosa in his book Clinical Applications of Ayurvedic and Chinese Herbs, Monographs for the Western Herbal Practitioner. And he cites some exciting research that is relevant to the use of REHMANNIA in allergies and autoimmune diseases. For example, constituents in cured REHMANNIA have been found to suppress antibody formation, and uncured REHMANNIA has been found to antagonize the inhibitory action of corticosteroids on adrenal function and thereby inhibit the catabolism of cortisol. In clinical trials, uncured REHMANNIA produced therapeutic effects also in rheumatoid arthritis, asthma, as well as urticaria. Several patients in the last year suddenly developed extreme histamine reactions, and they have found naturopathic support of gut healing through quercetin, urtica dioica, vitamin C, enzymes with and between the meals, and homeopathic therapies. Adding REHMANNIA may also be helpful. In vivo as well as in vitro studies, it has been shown that REHMANNIA could inhibit histamine releases from mast cells, indicating its potential for interrupting allergic reactions. Empty heat may develop at any of the stages we have discussed, but is more likely to develop at the third one when the tongue has no coating and is red. This yin deficiency and empty heat are two different pathological conditions, and that is also evident from the herbal medicines that are used. The herbs and formulae that nourish the yin are separate from the herbs and recipes that clear the empty heat. For example, Mai Men Dong, or tuber Ophiopogonine japonicas, and Qian Men Dong, so tuber Asparagi coccinensis, nourish the yin, but they do not clear the empty heat. On the other hand, Qinjiao, so Radix gentiana, Qinjiao and Qinghao, so Herba Artemisia annua, clear the empty heat. And of course, when there is empty heat, you combine the herbs that clear the empty heat with those that nourish the yin. And if you contact us at christine.doctor, as mentioned, we will develop a custom therapy plan for you that takes care of all your health problems holistically and naturally. With all that being said, also I highly recommend that you check out our video on vivid artemisinin, which is truly an amazing natural herb that helps with cancer, all types of inflammations. It has been proven to work also for COVID. It's truly a gift from nature, and I'm gonna link the video down below for you. Highly recommend it. Also, if you've enjoyed this presentation, please consider supporting us directly by becoming a patron from as little as $5 per month. Do not forget to like, share, subscribe if you're not already, and comment to help this channel grow and spread the truth. And also check out some of the most powerful holistic health tools available on the market today at vibrantbody.net. Some of those tools can also help you a lot with this Sjoegren syndrome that we've discussed in this video. And until next time, stay healthy.